There is nothing more wrenching than to see a teenage girl shamed by a fistula, wrote New York Times journalist Nicholas D. Kristof in his opinion piece in July 2014. I couldn't agree with him more, yet at the same time, there is nothing more joyous than to see a woman that has successfully undergone a fistula repair operation and who has been declared dry. About 800 women die from pregnancy or childbirth-related complications around the world every day. For every woman who dies of maternal-related causes, at least 20 women experience a birth-related complication like obstetric fistula. Generally accepted estimates are that at least 2 million women live with fistula in the developing world, affecting young and old. More than 50,000 new cases occur each year, while obstetric fistula can be prevented and in most cases treated. Contributing factors include inadequate health systems, lack of skilled birth attendants, limited access to emergency cesareans, poverty, malnutrition, traditional practices by dye, etc., etc. And even though it can affect all women, young adolescents are especially vulnerable. Coming from Belgium, a country that has one of the most wonderful healthcare systems of the world, it was rather shocking to see how little access to proper care and skilled healthcare workers most women and girls have in Pakistan and its neighboring countries. Since 2009, over a period of 3 years, I have had the privilege to work with Dr. Shersha Sayed, an inspiring gynecologist and very experienced fistula repair surgeon who puts all his efforts into helping women in his country that suffer from this terrible and often unnecessary birth-related condition. From tracking down the women suffering from obstetric fistula through rural surgical camps, getting them free treatment by performing repair surgery at Koigot, from teaching doctors and midwives to detect the condition, as well as training surgeons on the repair surgery itself. He is tirelessly working on this and inspiring everyone around him to help improve the conditions in which women give birth in his country. Following the entire process, I've been able to see what the prospect of a fistula repair surgery can do. First, it's about detecting the problem and finding women that suffer from the condition. That in itself is not an easy task. During mobile surgical camps, doctors hold consultations that can be very hard. The women often tell very personal and heartbreaking stories. Contrary to my country, where having a baby is usually a happy occasion, during the camps it's seldom happy stories to be told. At the camps, the doctors also perform emergency cesareans, operate on women with prolapsed uteruses, give advice on family planning, and consult with women with fistulas who have been detected by a network of local doctors, midwives, and former patients. It's amazing to see what the prospect of getting a fistula repair surgery does to a woman. It makes women that could be my grandmother laugh out loud. It gives hope, ends the shame, and puts a smile on a woman's face. Once a woman is scheduled to undergo a repair surgery, she is brought to Koigot Women's Hospital in Karachi or one of the other centers or hospitals that provide this care. With the help of UNFPA and private sponsoring, the women get free treatment and are well taken care of. I've met women of all ages with different stories about how they developed fistula, but the ones that really stick in my mind are young girls that have had multiple pregnancies, stillborn babies, and are leaking urine because of the complications arisen during labor. Around the world, approximately 16 million girls under the age of 18 have given birth, and for the majority of these girls, being pregnant isn't a well-informed decision. It's often the result of traditions like child marriage, gender discrimination, no access to family planning, or the complete lack of knowledge about family planning and how to prevent unwanted pregnancies. For girls delivering a baby before the age of 18, the risk of dying in childbirth doubles. Each childbirth is often associated with more pregnancies, short intervals between births, and therefore drastically increasing complications like fistula or the death of the mother, child, or in the worst case, the death of both of them. In Qatar Hospital in Karachi one day, I met Shamim and her husband. She had developed a fistula at the age of 16 after her first pregnancy. The delivery, assisted by a dye, went bad, with the complications resulting in a stillborn baby and fistula. She had 2 more pregnancies that resulted in stillborn babies as well, and now, at the age of 26, she had been treated by Dr. Shersha, was declared dry, and finally ready to go home. I was allowed to travel home with them and see her reunite with her family and her adopted baby, Roxana. At first, I thought the dye was the bad guy in the story, but it's so much more complicated than that. I've seen a home delivery that was very intimate and personal, with the girl's mother and mother-in-law present to guide her and keep her calm, even though she was lying on a concrete floor. Changing the situation of girls and women and changing the status of maternal health can only be done by education. Training midwifery students that go back to their villages to improve the conditions for women in these remote areas, raising awareness about safe childbirth and family planning, improving access to hospitals and skilled healthcare workers. The story isn't always that simple and often much more nuanced. I was privileged to have worked this extensively on the subject of women and childbirth in Pakistan, and I hope to continue doing so in the future. One thing I did learn is that education is key, and I hope this slideshow in a small way will contribute to that as well. Thank you.